Hi, I am Dr. Sudeep Singh Sachdev, Consultant Nephrology, Hypertension and Renal Transplantation, Narayana Super Speciality Hospital, Gurugram, and today I will be talking about tips to keep your kidney healthy. Now there are several ways to reduce the risk of developing kidney disease. So following are the tips to look after the health of your kidneys. The first and the most important tip would be to drink plenty of water. One should drink at least 10 to 12 glasses of water every day, which means around 2.5 to 3 liters of fluid in 24 hours, especially warm water, because it is more helpful for the kidneys. The water helps to flush out various toxins, salt and other uremic products from the body and maintains the homeostasis and correct balance of the body. The next tip would be to have a salt restricted diet or keep a low sodium diet all around. One should avoid intake of packaged or restaurant products. Do not add any extra salt to your diet. Try to keep your salt intake in 24 hours to less than 5 grams in a day. Taking excessive salt adds to the risk of development of hypertension, hypertension-related kidney disorders, and also increases the risk of progression of various kidney diseases. The third tip would be to maintain an appropriate body weight. Target a BMI of less than 24, especially in the case of Indians. If you have an excessive body weight or are obese, the load that has to be filtered by the kidney increases and can cause kidney damage in the future. Try to get your blood cholesterol levels checked and try to keep them under check, because if the cholesterol deposition happens in renal arteries, it will further damage the kidneys and leads to progression of kidney disease. The next tip would be to monitor your sugar levels and try to keep them under optimum levels. By optimum levels, I mean target an HbA1c of less than 6, a fasting blood sugar level of less than 100, and a postprandial or 2 hours post-meal blood sugar levels of less than 200. Damage is especially common in diabetics. It starts with proteinuria or protein leakage, which in turn gets converted to rise in the serum creatinine levels and rapidly increases the progression of diabetic related kidney disorders. So my advice is avoid any sweet products, avoid addition of any sugar to your products, and if you are a diabetic, meet a physician, take your drugs, the oral hypoglycemic agents which he has prescribed or insulin, and check them regularly and keep and maintain it to the target levels as discussed before. The next tip would be to monitor your blood pressures and keep them under control. Now, hypertension is both the victim and villain in kidney disorders. So, if you have high blood pressures, it can cause kidney diseases, can lead to its rapid progression. The truth is, if we think about it the other way around, that you have chronic kidney disease, then it can also lead to hypertension. So, restrict salt in your diet, keep a healthy lifestyle, balance your lifestyle in a way that your blood pressure is under control. If you are a hypertensive, visit your physician, take the tablets that he has prescribed and regularly monitor your blood pressures. The target blood pressures would be less than 120 by 80. Coming to the next tip, get your kidney function tests, urine analysis and imaging investigations of the kidney, which includes an ultrasound, KUB, done regularly. If you are a high risk patient, which include diabetics, hypertensives, patients of coronary artery disease, metabolic bone disease, obesity, then one should get themselves tested even more often. If you have a family history of these diseases, again you are at high risk, or you have a family history of kidney diseases, then you are at high risk. Get these tests done. If there is any abnormality, meet a nephrologist and prevent the further progression of kidney disorders. The next step would be to quit smoking. Another one of the most preventable, modifiable risk factor would be smoking. Everyone knows smoking increases the propensity of coronary artery disease, strokes, hypertension, worsens diabetes, but few people know that even smoking 1 cigarette per day actually leads to progression of kidney disorders. So if you are a smoker and you have a kidney disease, it will manifold increase the risk of progression. So my advice is strictly avoid smoking. It is a quintessential requirement for those people who have kidney diseases. Maintain an active and balanced lifestyle. I would suggest that do a moderate exercise of around 45 minutes per day, 5 out of 7 days in a week. By moderate exercise, I mean jogging, cycling, swimming, various kind of racket games. Do not follow any sedentary lifestyle. If you have a sedentary lifestyle, try to move around in your office, take a stroll after having your lunch, because all these increases the chances of obesity and metabolic syndrome, which further predisposes to kidney disorders. One of the most important tips that I want to give you is avoid the unnecessary use of any painkillers or any alternative medications. We know that most of the people, in case of even a small headache, go to off the corner shops, take various painkillers like Brufen, Combiflam, Indomethacin. All these painkillers are not good for the kidney. Voveron is used a lot by patients nowadays. These painkillers have been implicated in the progression of chronic kidney disease, especially chronic tubulointerstitial disorders. So my advice to you is please avoid them. Also, if you've taken these painkillers, get your kidney function tests and urine analysis done. Relatively kidney safe painkillers would be paracetamol, tramadol or Ultracet. Last but not the least, balance your lifestyle. Take a restful night's sleep of around 8 hours. This is extremely important to keep you healthy. Thank you.